Hello, and welcome to the first session in our series on Untangling the Challenge of Aging, Vital Decisions. In celebration of National Hospice and Palliative Care Month, we offer this series of webinars to our community free of charge. This month, in all sessions, we're focusing on a theme of the vital decisions we may need to make to stay safe. We appreciate you joining us today. I'm Melissa Lindley with Willamette Valley Hospice and Palliative Care, and the moderator of today's session, Staying Safe in Your Own Home as You Age. A special thank you to our sponsors who helped to make this series possible for all of us. Title sponsor, Call Your Law, and corporate sponsors, Salem Health Foundation and Oregon Oncology Specialists. You can still register for the second and third session if you have not done so by going to wvh.org/calendar. Please invite your family and friends to participate. Any donations that are offered will be gratefully accepted and go towards our community bereavement programs. Visit wvh.org for more information on all of our programs and this series of Untangling the Challenges of Aging Vital Decisions. You will receive a recording of today's session in the next few days, along with a survey. We'd really appreciate any feedback you have on the program, format, and the topics. Questions will be answered at the end of the presentation, and any that do not get answered due to time will be addressed via email to you. Enter your questions in the chat box to the right on your screen. We have a lot of information to cover today. So if we don't have time to get to your question, please email us your question so that we can be sure to address it. Susie Deeds with Northwest Senior and Disability Specialists, as well as Kevin Hohenbaum, my coworker from Willamette Valley Hospice, along with myself, will be presenting together on this topic today. Welcome, Susie. We are so glad to have you and appreciative of your time with us. Let's all dive into this important topic. COVID has us all thinking about staying safe. Staying home doesn't always mean staying safe, especially as our needs change as we age. So, how can we stay safe at home as we age? Most people's needs involve a continuum of care as our health changes. Fortunately, there are services to help and plans we can make to ensure that our needs are met. So today we're going to talk about 3 of those services specifically: in-home care, palliative care, and hospice care, as well as when they can be utilized and how. Susie, will you please start us off with telling us more about in-home care options? When should we start thinking about whether it's time to start getting additional help for yourself or your loved ones? I'm turning it over to you.
All right, thank you so much, Melissa, for inviting me. My name, again, is Susie Deeds with Northwest Senior and Disability Services. And in my job as an options counselor, we often get this question, when is a good time to start thinking about in-home care? And I would say any time is a good time to start educating yourself about in-home care and really understanding in-home care. As options counselors, we get a lot of folks who maybe have just been diagnosed with a diagnosis such as Parkinson's or dementia, and they want to talk about what happens down the road when I need it. So the first thing we talk to them about is there are different options for in-home care, not to be confused with home health. I always like to talk on home health a bit because home health is often covered by Medicare or insurance. That's something that our doctor can order for us, and it's a short-term resource that usually is covered by insurance that brings physical therapy, occupational therapy, sometimes speech into the home. With that, we get a nurse, and at times we might get a bath aid. So it's really important, if you're interested in home health, that's going to be separate than in-home services. And that's something you really want to talk to your doctor about to see if you're eligible for that. Often folks are eligible or usually get it after maybe a hospitalization if they're homebound. But sometimes if there's been a change, maybe you're having issues with balance, Maybe you're noticing a change in your cognition. These are times that you may want to talk to your doctor to see if you're eligible for home health, which is more of a short-term resource that we can utilize in our home. Very different from in-home services, which I'm going to touch on today. Now, when we talk about in-home services, we should start at least educating ourselves about early on. And then we might want to start thinking about, making the first move on that when we're starting to have a hard time doing those things around the house that we used to not have a hard time doing. So it might be, with you're needing more help with housekeeping, you're needing more help with your hygiene, getting out of chairs, toileting. There's a variety of reasons that you might need some help in the home. One of the first places that I encourage folks to start is our Aging and Disability Resource Connection here at Northwest Senior and Disability Services, as there's several in-home programs we have through our agency. One is called Organ Project Independence, and it can actually bring help in the home for people who their need is great enough, no matter what their income, resource, or citizenship is. So that's a great program called Organ Project Independence. And then the other one that people are more familiar with is in-home services through Medicaid. And that's more for folks who maybe have financially got a little less in resources. But both of those are great programs to learn more about if you're starting to need help in the home or if your loved one needs some help in the home. The other thing is we can also, and that's what I talk to a lot of folks about as an options counselor, is we can also hire caregivers. And there's two routes we can take. We can either hire someone privately, either off the list for the state of Oregon, maybe someone who's recommended by a friend or family. We are the employer in that situation, and we're hiring a home care worker to do those tasks for us. That might range from like 15 to 20 an hour usually. Or if you want to go with an agency, which is, licensed, bonded, they do the hiring, they do the criminal background checks, all of that, then you can go with an in-home agency, and that's going to be, more from like 25 to 35 an hour. But they're doing all the, employment pieces that you, may not want to do, like taxes and such. As options counselors, we have some material that talk about, if I want to hire privately, what are some things I really need to think about if I'm the employer? And then also, I just want to mention this little book, Retirement Connection, which you can find at places like Fred Meyer or, by calling our Aging and Disability Resource Connection. This little booklet has a lot of in-home agencies. So if you want to go that route, they're listed in there. If you're wanting to, look at the list for the state of Oregon to hire care, you'd probably want to contact our Aging and Disability Resource Connection, which I will put in question and answer area there. Also, one thing I want to touch on is some folks tell me, well, I don't need to worry about that. I've got long-term care insurance. One thing I'd really encourage folks to do if they have long-term care insurance is really educate yourself as to what the policy says long before you ever need that policy, so that in the crisis, you know how to utilize that policy. So that's what I always encourage folks to keep in mind. So we talked a little bit about, how you can meet with a care options counselor to talk about, how do I go about hiring care? What are my options? If you're kind of early on in that, like you're just, we get a lot of calls where they've just been diagnosed, or maybe they're starting to have needs and they're thinking, what might it look like down the road? The state of Oregon did a lovely booklet called Planning for the Future, and it talks about some of these things that we're going to talk about today. And it's a great resource that you can request through the Aging and Disability Resource Connection or from an options counselor to learn more about things you might not have thought of as you're aging in place, for those who, you know, are invested in wanting to be at home as they age. So also, anything else that I needed to touch on, just make sure you know, a lot of people don't know that Oregon Project Independence is based on need, not income or resources. So a lot of people are eligible for that program that don't realize they're eligible. And then, so if you're wanting to learn more about that, I'm gonna put that aging and disability resource connection phone number in the chat and for the question and answer. So I think that's it for me. I will go ahead and pass it on to Kevin.
Great, thank you, Susie. As Susie was talking about, a lot of the things that will really help is that planning in advance and being prepared, making those decisions, researching the insurance policies, etc., before you have an urgent need, so that you can go into your situations educated and making clear choices about what it is you want to do. I'm going to talk a little bit about home-based palliative care. Home-based palliative care is a program to help you when you need to, your needs exceed, or your family members' needs exceed what can be done at home without having additional help, professional help come in. And one of the choices that Susie talked about was having some home care come in, and that can be really useful at the right time. But there can be times when things progress to a point where home care is just not enough. You actually need some real clinical support, and palliative care is one means of getting that clinical support. So how do you decide palliative care may or may not be appropriate for you? Well, one of the triggers you want to look for is when are your healthcare needs feeling overwhelming to you or to your loved ones who are helping with the caregiving. When that happens, palliative care might be appropriate. The goal of palliative care is to help manage whatever illnesses are going on in your home. Home palliative care also will sit down and help you determine and set healthcare goals and kind of look and help you project what might come next. The home palliative care team is led by a nurse and a social worker. We also have Willamette Valley Hospice and Palliative Care also has providers on staff, both nurse practitioners and physicians, and they are part of that team. You may or may not, if you are on service palliative care, you may or may not see that provider, but they're in the background working with your own primary care provider. One of the important factors about home palliative care is your primary care provider remains your lead caregiver and the lead person who sets the care plan. The rest of the team is there to help put the care plan in place and help you execute whatever that plan is. But it's still the primary care provider who really is that you're working with, the same person you've been working with, who is leading the whole team. Our team kind of becomes the hands and the feet and the eyes of the primary care provider in the home. We also have available as needed spiritual counselors can help with palliative care, and health aides. And that's having somebody come in and help with some specific home projects. Home care can be a part of that. Again, it depends on a few different factors. One of the most important factors, of course, is coverage, insurance coverage. Palliative care is not reimbursed by Medicare. However, it is reimbursed by all of the Medicare Advantage plans that serve the Salem area. The Polk and Marion County areas, also available with many of the commercial insurances. And we just advise you to give us a holler if that's something that you want to explore, and we can do what we call as a benefit check, and we can check with your insurance company and see what the coverage might be. So it's important to kind of have those things figured out in advance. The advantage of having our staff coordinate with your primary care provider is they really can speak both languages. And sometimes I know when I go into the doctor and they say, my doctor says, well, this is happening and that's happening and that's happening, and I leave there, kind of confused over exactly what all those words were and exactly what that all means. And a palliative care team will help you with that interpretation and help you know what next steps could be. There's also an advantage because on palliative care, you do have 24-hour availability for emergency services. So if something goes wrong and you need some help, then we can send somebody out there as needed. The goal of palliative care, one of the goals of palliative care really is to help you plan and help you prepare for what comes next. And our teams are experts at disease progression, no matter what kind of things are going on, combinations of things going on, and they can help you really think through. Am I going to be able to keep living at home? Am I going to be able to, do I need to hire a paid caregiver? What are the triggers? When do I need to hire a paid caregiver? Is my family members going to be able to take care of me? Do I need to have some additional help? Am I going to need some other interventions, other curative things, and what are the choices there? And that's all part of the discussion of advanced care planning. We talk about choices and what your personal goals are, and we want to help you reach those personal goals, but it really helps to have a team who can help you talk through those and help you know in advance. So as things occur, you already have a plan in place. You know where you're going. You have an idea. You know, clearly, as humans, our physical side is totally unpredictable. We never know exactly where we're going or when we're going to get there, but our team can really help you get your hands around what lies ahead. That's really can be really useful, especially when you have something chronic that's going on and then maybe something else comes in and joins that as well, and it can really be helpful. We talk about our team really helping manage your symptoms. That's really an important part. And very often, as people age and as more chronic illnesses occur, people have 2 or 3 or 4 doctors sometimes. You know, so you might be seeing one doctor for heart things and one doctor for breathing issues, and then your primary care provider. And sometimes the doctors and the providers are really good about communicating with each other and taking into account this medication that you're on before they prescribe this one. And sometimes it can be somewhat uneven. And again, that's a place where the palliative care team is really expertise is at managing those symptoms as a whole and managing multiple medications as a whole. One of the most important parts of the palliative team's work is to support the families and caregivers. So whoever is doing that caregiving, whoever is playing that role, whether that's a family member, whether it's you're in a senior living community and it's the caregivers in the senior living community, assisted living, whatever that looks like. Our job as a palliative care team is to support not just you, but also your caregivers as well, and to help them know what lies ahead and what comes next, to help them make those plans and understand where things and be there to answer questions. Our palliative care, as somebody on our palliative care, one of the things we do is we reduce hospital trips, unwanted hospital trips. We're not trying to keep you from the hospital, but what we want to do is we want to help you help teach you to manage all the things that are going on for you, help teach you to manage those at home. And one of those things is it helps you reduce the hospital trips. Maybe you'd like fewer appointments out of the house. Maybe you have mobility issues, transportation issues. Those are all things where palliative care can help, because our goal is to help keep you on home. A question that often comes up is, well, how long can I stay on palliative care? Well, there isn't a limit to it per se. There isn't a limit from insurance perspective. The limit that we have on it is really just based upon helping you reach your goals. It's very frequent that people will come on palliative care for some period of time, a few months, 6 months, whatever, and we help them get to the point where they're able to manage what's going on and things are coordinated and everything's in a good place, and they leave the palliative care support and they are just going to their primary care and their normal doctors like usual. And then maybe at some point in time, a year, 2 years, 3 years down the road, something else occurs or something becomes more complicated and palliative care needs to re-engage, then they give us a call and we get a doctor's referral and we re-engage. So that's not uncommon. People sometimes are on for a very short period of time before they move on to another care kind of level of care that's going to help them reach their goals. And sometimes they're on there for a long time. And it just, again, depends on the individual needs. Again, always our goal is to help you coordinate what's going on and to help meet your care plan goals. Palliative care team is also really good at helping you connect to local resources. And again, Susie and Senior Disabilities is certainly a place that we are sending people all of the time, because they are a great place for resources. But sometimes there's just some things that you may need. Maybe you've reached a point where you need a wheelchair ramp put in, and you don't have the skill or the ability, or know somebody who can help you with that. And sometimes our palliative team could help you with that kind of a challenge. It doesn't matter what the need is. We can help you locate what some people who might be able to help you with. Some things that are triggers that you want to look for. Has there been a significant change in condition? Have there been 2 or more hospitalizations or emergency room visits in a 6-month period? That's a trigger that might be time to look at palliative care. Are there multiple serious illnesses happening? Or is there something that's just so symptomatic despite the treatments that are doing that's really impacting your quality of life? That might be a time. Sometimes a trigger might be unintentional weight loss over a period of time. That might be over 6 to 12 months. That's something we look at often, can be a trigger. Sometimes it's just progressive declining ability to complete your activities in a normal way. And as Susie talked about, maybe now you need some help getting dressed, or you need some help with bathing and hygiene, or need some help. Sometimes it's just help around the kitchen, or help with shopping. And there's different resources for all of those things. The home care that Susie talked about is really good for a lot of those home projects or home tasks. Sometimes there's more than that. Sometimes things kind of develop into a bigger decline where you need additional help. And again, those are triggers for palliative care. A lot of what we want to do is educate and help you plan. Sometimes people will involve palliative care when there's a new diagnosis of something that's like, wait a minute, I wasn't ready for that. That wasn't something I thought I was going to be facing. And that again is a time where our team can come in and really help kind of figure out what that looks like in your situation and what in your circumstances and what might lie ahead. Sometimes somebody just needs some help making some decisions. There are times often when you visit a doctor and a doctor will say, well, you could do this or you could do that. And in the doctor's role, very often, they won't say, I think you should do this or I think you should do that. Sometimes, excuse me, you just need a little expertise to help you. And again, palliative care is really good, really helpful for that. Is your support system adequate to meet all of your needs? Do you have family who can help you? Are you living in a place that has the support you need? Palliative team can help make you those determinations, help you have those discussions, and help you get things ready. The most important thing I think of the palliative care team and the work that they do is really they advocate for you. They're going to be working with you, with your primary care provider, with the multiple physicians, if that's what you have, or caregivers that you have, and really help everybody be on the same page. Because it's about you and it's about your wishes, and it's about helping you reach the goals that you set for yourself and understand what those goals are. So our goal always, as in this session here, our goal always is to educate and to help teach people to make those decisions on their own and to be there as a resource when people need that help. At that, I'm going to wrap up my talk about palliative care and pass this off to Melissa. And there is a place to ask questions, which if you look on your screen, you should have a little talk box with a question mark in it. And if you click on that, it'll say show Q&A, and you can ask questions, type those in there. We're going to get to questions at the completion of Melissa's presentation. So Melissa, thank you.
Thanks so much, Kevin. Wonderful. Well, what I'd like to talk about next is hospice care. And this is so important for many reasons. And I know a lot of people, they hear hospice and they think, well, I don't have anybody that's in that last stage of life, or we're not there yet. So I kind of don't want to have that conversation or discuss hospice. But I can't emphasize enough how important I think it is to think about hospice, consider it, and talk about it and make plans for it long before you need it. Just as Susie was sort of encouraging this planning ahead guide, this is just part of the continuum of care that someone may need. And so I really want to encourage you to learn more about hospice long before you need it. I want to share a couple slides like Kevin did, so give me just a second here to do that. All right, here we go. So let's talk about hospice care in general. The trigger, someone might be on palliative care and, as Kevin said, go off of palliative care, but there also could be a trigger that something happens that says, oh, maybe hospice care is appropriate now, or that someone could be eligible for hospice care. So again, the things that you might be looking for hospice care would be things like, a big change in health, that things are really different today than maybe they were 6 months ago in terms of what my loved one can do or myself. It also is a shift from curative to comfort care when we go on to hospice. And so that means that the person needs to be in a position where they're okay with not continuing curative treatment. And when we talk about curative treatment, we're generally talking about things like dialysis, chemotherapy, maybe even blood transfusions. And they want to shift to thinking more about comfort and about living each day the best it possibly can be. So that may mean that the trigger for many families is that curative treatment has become too burdensome, or we are not getting the benefits from curative treatment and we're only getting the side effects and the bothersome side effects. And so that may be the trigger that someone says, I think I might be ready for hospice care and to discontinue this curative treatment. So hospice is really a beautiful thing that doesn't exist anywhere else in our healthcare system. It's this holistic service that really looks at the whole person and their family, and not just about their physical health, but also about their emotional, spiritual needs and their day-to-day quality of life, focusing on comfort. And our goal in hospice care is to enable patients to be comfortable, pain-free, and to help people live each day as fully as possible. And that is the crux of hospice care. And like palliative care, hospice care is delivered in the home, wherever you live, and by a team of experts. But you're going to notice that the team is a little bit different. The services are a little bit different. Everything is expanded a little bit more with hospice care as opposed to palliative care. First, I think it's really important to recognize also that hospice and palliative care is a medical specialty. So that means that just like you would consult a cardiologist if you have a heart problem, that there are experts in hospice and palliative care, and we are those experts. And so that means that it's important to get those opinions and advice when you're addressing this phase of your life. And we are the appropriate folks to ask those questions. Of course, asking the questions, gathering your information doesn't mean you're signing up tomorrow, right? But just like you'd go consult with a cardiologist, maybe even get a second opinion when you've had a big health diagnosis, the same is true for hospice and palliative care. You can gather your information and get opinions and then make the best decision for yourself or your family member. So let's talk a little bit about that team that provides that hospice care. That team brings that physical, spiritual, and emotional health right into your home, wherever you live. And they include a nurse case manager, a medical social worker, a hospice aide, a hospice physician and nurse practitioner. And these are the folks that are always assigned. So everybody gets a nurse case manager that I like to think of as the ringleader of the team. And then that ringleader kind of brings in all the necessary team players to give the best service possible. So that includes the medical social worker. I like to call them sort of the Jacks and Jills of all trades. So Kevin was talking about gathering resources in the community. Maybe to one family, their biggest need is pain management, but to another family, it's that we could be evicted from our house next month. The medical social worker is going to help gather those resources to see what can be done to help that family with whatever their most important need is. The hospice aide is an integral member of the team doing that personal care, bathing, light housekeeping for the family. And of course, that physician oversight by our hospice physicians, our nurse practitioners, available to be able to make changes to keep our patient comfortable and available to our staff at any time is just so important. Of course, there's lots of other services with hospice care, some of which are not available in all hospices, you should know. So that care can vary hospice to hospice. But at our hospice, being a nonprofit hospice, we offer a lot of extra services, and we do have, in addition to a spiritual counseling services, grief and loss services, we also offer music therapy, massage therapy, and extensive volunteer services that could include someone to give a family member a respite break, as well as a pet therapy volunteer to just come and bring some joy and, you know, that kind of attention and love that a pet can only provide. The services like palliative care brought to you in your home frequently by members of the team. And of course, those members are your choice. We have some families that say, please, I would like every service. Bring on the massage therapy, bring on the pet therapy. And other people that say, I don't want that many people in my home. I want to manage my symptoms, but let's just keep it to the basics to start. So it's really empowering for you and your family to make all those choices. The services also include your related medical supply and medications, and that 24-hour on-call support that is vital when a new symptom starts or a family caregiver is needing a question answered. And important also is availability. It is open to all who qualify with a prognosis of 6 months or less to live, and is covered by Medicare, Medicaid, and pretty much every private insurance. So this is important to know. As a nonprofit hospice, we are really committed to providing hospice care to anyone that needs it. So oftentimes hospice is brought up by your medical provider as something that they think could benefit you depending on where you are in your health. But sometimes it's brought up by the person themselves. So it's okay to talk with your doctor about hospice and to ask, when do I qualify? You know, my own grandmother actually was referred to hospice and she had dementia. It can be kind of tricky to know when someone with dementia qualifies for hospice. When is that 6-month window? Well, we have certain things we're looking for depending on someone's health situation or diagnosis. And we try to help local doctors know what to look for and when someone would qualify. So when my grandmother was referred, our hospice nurse went out and evaluated her and said, you know, she doesn't quite qualify. And we were able to ask those questions. Well, how would we know? What should we be looking for? How will we know she's in that phase of life? And so having that nurse give us that advice, because they've seen it hundreds, if not thousands of times before, is so helpful to the family. And our family really appreciated that and was able to reach out and get the help when it was time and to know what to expect. So, of course, we like to say in hospice, there's no crystal ball that we found to be super accurate. And so we're all doing our best. So someone that's referred to hospice, if their life extends beyond 6 months, then that's great. They can still stay on hospice as long as two medical providers are still in agreement that their health is declining to the extent that their life will likely end within 6 months. And that just sometimes happens. Sometimes folks have a slower end of life process, and other folks have one that goes, much too quickly, as most of us know. So we're always just evaluating that individual situation to see what works best for that person. One of my grandfathers also came onto hospice for some of the reasons that Kevin was mentioning. Maybe he was mentioning that maybe extra emergency room visits or wanting to stay out of those emergency room visits kind of motivates people sometimes to call and reach out for services that can be managed in the home. I think we can all agree that nobody really wants to spend their time in the hospital unless they absolutely have to. So one of the big benefits for hospice for one of my grandfathers was just to avoid those emergency room visits. He was having a lot of issues with falls in his home, and his son was having a hard time managing those, and sometimes they'd happen in the middle of the night and they'd be off to the emergency room, and there was only so much the emergency room could do. They were basically just making sure he was okay, and they said we just really wanted to make sure he was okay without having to haul him into the emergency room. And that's where hospice was a great fit for him, because we could be available 24 hours a day to offer that advice, to come out and make a visit if something happened, or just those regular visits to check in, to maybe look at those factors of what was causing those frequent falls, and is there anything we could do to reduce the chance of that happening to create just a better quality of life. And I'll say his son was a little skeptical of hospice at first. He was not sure about strangers in his home, and I don't know if my dad will like that or not. But at my grandpa's funeral, he told me that it was the best decision he's ever made in his life. So having that extra support in this phase of life can make really a world of difference. And that support is available. We want to make sure that hospice is available to anyone that qualifies. And sadly, a lot of people come to hospice or think of hospice just as the last few days of life. And that's because often they just don't get referred until then, unfortunately. They might end up in the hospital and finally someone says, have you considered hospice? Maybe a patient is thinking, gosh, I don't want to continue these treatments. I just feel sick and I'm not getting any benefit, but I think I should. So, and my doctor hasn't mentioned anything different, so I'll just keep going along. And maybe, someone's physician just doesn't have time to have that hospice conversation in these short appointments that they've had recently with their client. So that's why it's important that all of us learn about hospice on our own, seek out information like today so that we can be educated and advocate for ourselves or our loved ones, because most of us are going to be in a position to need to do that for ourselves or someone else at some point in our life. And when that time comes, or when we want to get that information, we know who to ask and what questions to ask. So sadly, like I said, a lot of people just come onto hospice in the last week of life or the last couple days of life. And so that's often what we have in our mind or what we've seen on TV as what hospice is. But really, hospice is something that can help for 6 months and sometimes longer. We've had lots of patients that have been on hospice longer. And I've never heard someone say, I wish I wouldn't have gone on hospice sooner. But what I hear all the time from hospice patients or from family members is, I wish I would have called sooner and started these services earlier. They could have helped us so much sooner. And so I think that's something we can all learn. I know I've learned that, and I've implemented that in my life with my family members. I've advocated for hospice, and that's something that we all can do to make sure that we get the services that we're entitled to, that full 6 months if we want it. And of course, I'm biased, but I've seen the difference it makes both in my own family members as well as in the community. I want to make sure we leave enough time for questions, but hopefully I've covered the basics of hospice. I did want to show you one other thing, because Susie talked about home health as well as in-home care and the differences between them. Kevin talked about palliative care, and I discussed hospice a bit here too. But oftentimes people get a little confused between home health, palliative care, and hospice. We're going to send you this handout that we made, but I want to share it with you just briefly so you can see it. Here it is coming up on your screen for you. And you can see that this is a kind of a comparison list of home health, palliative care, and hospice. So these are kind of the clinical services, right? The ones that deal with your medical care, and as opposed to in-home care that Susie was talking about also. So comparing these and just noticing who they're intended for, the treatments that are included, the staff that's involved, the services, payment, and goals of each. Now, I'm not expecting you to read this all right now. This is a handout we're going to send you in your email when we send the recording of this program, and you can feel free to share this program with friends and family members, pass it along, as well as the handout that we'll send you. But I just wanted you to notice, we talked about home health being that short-term service with specific health goals, not your entire health, just a specific health goal. And palliative care being that added layer of support while still continuing that curative treatment. And then hospice being that holistic care that really covers all of the areas of your life, focusing on comfort and quality of life. Just notice how long these are. So here's the home health, shorter than palliative care, shorter than hospice care. I noticed this when we were making this for you. Just the services expand with each level of care on this continuum. So we'll be sure that we send this to all of you. And I want to bring back my co-presenters here and get to some of your questions. I know I wanted to ask Susie one especially, and I noticed that there's a couple questions in the boxes here. So I'm going to turn it over to Kevin, who's going to help us get those questions answered.
Great. Thank you, Melissa. That was very engaging. That was terrific. Okay, Janice is asking, is there help available after discharge from hospital after surgery? My orthopedic surgeon says they're not placing patients in rehab due to low staffing and COVID issues. Now, Susie, I think this is probably a question to come your way. And actually, I was listening in on some phone calls yesterday at our front desk, and we had for a short period of time.
Me.
There we go. Now we got you.
Sorry about that. So, first of all, I think that you really want to contact, one, you want to have the conversation with your doctor to see if he's going to order, she's going to order outpatient therapy or home health, depending on how you're doing. So that's really important. And then if you're feeling you need more, really understand what home health is. And if you really feel you need more than that, that's where you may want to contact the Aging and Disability Resource Connection to learn more about in-home services, hiring care, if you're eligible for any of the programs. I have people who meet with me a year before, like I may have surgery. I want to talk, about the what ifs. And so those are really good times to, maybe talk to your doctor first and then talk to the Aging and Disability Resource Connection.
Great. Thank you. Here's a question that's, if I have a diagnosis like cancer and I just need help for the time being, would that be the time to engage palliative care? And the answer is definitely yes, that would be a time to engage palliative care. That is a very regular diagnosis that we're working with the people who are on chemotherapy. And as people are going through different different kinds of chemo or radiation, then that has totally different impact on different people and the way how they are cope with that and what that impacts them at home. And our team can really come in and help mitigate those symptoms and help you coordinate what's going on. And then when things are done and you're back on the mend again, then palliative team exits. Melissa,
Kevin,
I think this next, oh yes, go ahead.
Did you see the question earlier in the chat that Betty had asked about long-term care insurance versus palliative care? She had asked, does it cover, and I touched on it a little bit, but I thought you might, better explain how palliative care is covered.
Sure. Great question. And I didn't see that. Thank you for pulling that up, Susie. The palliative care is covered by, I think I mentioned numerous commercial insurances, and they can be a little bit specific in how they cover and what they cover. So if it's something you're interested in, then please give us a call and we can do a little research on that. Palliative care is also covered by Medicare Advantage plans as well, and that covers the costs of people coming into the home, doing the coordination. It doesn't have any impact or change in any way your medication costs or anything else. Those remain covered just as your normal insurance is, whatever that looks like. If you're wherever you're getting your meds and et cetera, that comes the same way. But what palliative care covers is that team that's working with you and coming into the home. Melissa, I think maybe this next question will be one for you. Does hospice cover Oregon's death with dignity option?
Yeah, I get that question sometimes. So hospice is not involved with the Oregon Death with Dignity Act, but we have had patients that have utilized the service. So hospice isn't something that we don't prescribe the pill. That it has its own process that someone needs to go through involving several appointments. And there are certain organizations that actually can assist someone with the process and help educate them on the process. And there are physicians that actually do the prescribing of the medication, to utilize the Oregon Death with Dignity Act. So we can refer to those organizations that help explain the process and offer those services. That's normally how that goes.
Great, thank you, Melissa. Here's another question for you, Melissa. Is hospice available for people who live alone with no support system?
Well, most people who are dying will need support at some point in time. However, I will say I have met several patients that do live alone and receive hospice. So this is, hospice is, I'll say yes, hospice is available for people who live alone. Now, our team is going to help you evaluate your health as your health changes and help you understand your options and care needs as your health changes. So part of that is that planning. How could we develop a support system for you? I recently talked to a patient who was able to be safely at home a lot of the day, but she had someone that would come check on her multiple times, and she checked in by phone a lot with people too. So mixing that with hospice visits, that worked for a long time with her. Now, how that worked the last couple of days of her life, I wasn't involved, so I couldn't say, but at some point, generally, people do need some help. And so there are options, including our Edward F. Tokarski home. We have an adult foster home for 5 hospice patients at a time. So there are lots of resources out there, and we have sometimes respite and vigil volunteers that will sit with a patient who has no one else to sit with them during the last day or two of their life. So I've seen all kinds of circumstances happen in hospice care, and it's all very individualized, and our team would work with someone on that.
Great. Back to that planning piece again, huh? Knowing what's coming next.
Right.
Here's another question, Melissa. Can I refer my mom to hospice? What would be the next steps?
Yeah, definitely. You can reach out to us at any time to get more information, and all you have to do is give us a call. It's as easy as that. Our number is 503-588-3600, or you can find us online at wvh.org. And our team can arrange to, well, first we'll discuss with you your mom's health and answer any of your questions. And then normally the next step in the process is to meet with a member of our team to have a more in-depth conversation, and then to have an evaluation to make sure, again, ethically, that your mom would be in that last 6 months of life to qualify for hospice.
Great, thank you. Well, that seems to be all the questions that we have. People have published at this point in time. Susie, Melissa, any last words before we wrap up this session?
No, thank you guys so much for joining us. And I will mention one more time, anytime you're looking for information, contact the Aging and Disability Resource Connection, and of course, contact Hospice too, because you're going to get good information, different resources, some of the same, but both options are great. So I will put that in the box again, but thank you guys for inviting me. I appreciate it.
Great. Thank you. Thank you, Susie. Thank you, Melissa. And thanks to our technical expert, Taylor, for helping make this all happen. And we appreciate you guys spending some time with us. If you have any questions, please, we're all available to listen to you. So thank you very much and have a great day.
Kevin, are we leaving? Okay.